question about the Healthcare Workforce Resilience Act. And I think really important to talk about that act, what it means, where it is in Congress. And Chris really is an expert in that area. So I'm really grateful to have you here, Chris, and to share this information with so many people. I actually was just thinking as we were talking that just to share with everybody, Chris and I did a webinar for hundreds of clients this week in the US on this particular act. And people are really interested in it, and we are working very hard behind the scenes, everybody involved here in the US, to try and get to educate the clients, the hospitals and the nursing homes and the rehab centers, etc., about this particular bill in Congress, so that they can get behind it and can lend their support to the senators and the House representatives. But I'm actually just thinking, Chris, I might actually just share the some of the slides that we had, and you can maybe talk that through with everybody. I think that could be really helpful. Please remember, everybody, as I'm sharing this with you, Chris will talk you through these slides, but please make sure to share this with your friends and colleagues. This is really important information for you to understand, because if this bill comes into play, which we will hopefully know in just a few weeks, and if it is positive, it's going to be a fast track and a way of expediting green cards for nurses. Can you see the slides, Chris?
Yes, no, I can see it on my screen, so I suspect everybody can.
Okay, good.
Yeah, so Tanya and I did a call with some of her clients the other day, earlier this week, and so this was a slide that I put together for that. And so these, I think, are some of the most important points if you're starting to learn about the Healthcare Workforce Resilience Act. So this is a bill that was introduced into the U.S. Congress a few weeks ago, early May. And there we go. And
there we go. Sorry.
That's it. Yep. And so in order to get a bill passed in the United States, you have to have support in the U.S. Senate, and you have to have support in the U.S. Congress. And just in 3 weeks, we have had an enormous amount of support. We have about 20 of the 100 senators in the United States Senate have already agreed to co-sponsor the bill. That means they're essentially saying up front that they are in favor of this bill. And not only are they in favor of this bill, but they are helping to try and attract more senators to support the bill. And we have had 26 out of about 420 or 430 or so House members, which doesn't sound like a lot, but it's actually quite a bit. Even more impressive, the mix of the 20 senators and the 26 or 28 House members is bipartisan. There are two main political parties here in the U.S., the Democrats and Republicans. The Democrats are what were President Obama's party, and the Republicans are current President Trump's party. And as you might imagine, if you follow any of the U.S. politics, those two groups do not agree on much. But in this bill, we have a 50-50 breakdown of both Democrats and Republicans, both in the U.S. House and the Senate. So that's bipartisan, and that is very encouraging for us. So that's all the good news on the process. The bill, I think if it's going to be passed, we're going to know this summer. It's either going to be passed or it's not going to be passed. I'm saying roughly by about the end of July. And that's because by the end of July, the U.S. Congress is going to go on their summer break. They're going to be out until early to mid-September. And then the U.S. Presidential election, which is President Trump versus Vice President Biden, who was the vice president under Obama. They'll have their election in November, and traditionally no real legislation goes in September and October before a U.S. presidential election. So again, I think we'll know everything by the end of July. It's going to be just in the next maybe 2 months or so. So that's the first reason, because of just sort of the calendar. The second reason why I think it's going to happen by the end of July is this bill is really targeted to helping U.S. patients during the COVID-19 crisis. And the COVID-19 crisis is here and now, but hopefully it's not going to last forever. And so for those two reasons, I think we will know if this bill succeeds or fails in the next 2 months by the end of July. So that's the process. In terms of likelihood, it's hard to predict likelihood on legislation. I can tell you this, though. I've been going to Washington, D.C. To advocate for legislation, often in the healthcare area, for about 17 or 18 years. And this bill has more support than any bill that I've ever worked on. And I've actually been part of groups that have actually had bills not just be introduced, but have actually passed and been signed into law. Most notably, back in 2005, we had a bill very similar to this Healthcare Workforce Resilience Act in 2005. And, I was a small part of that effort, and that bill actually didn't even have as much support as this bill. So that's all reason for optimism, but this is by no means a sure thing. We need to continue to build up support of senators and House members, and we've had a very excellent May here, and hopefully we can continue that into June. Okay, so what does the bill do? I'm going to talk specifically about nurses, although there is an analog provision, as you can see, for doctors. But for a nurse, and if you're a nurse in the Philippines or anywhere else around the world, here's what it means. We think there's a backlog of retrogressed nurses. We don't even think that. We know that's obviously true. In fact, maybe many of you who are listening in on this session, all of the nurses who are currently retrogressed, whether they're Indian nationals, Philippine nationals, or any other country, if this bill passes, you will get a retrogression-free visa. And really, if this bill passes and you have your I-140 already approved, you will just simply have to go through the NVC process, and you will have to schedule an appointment at the embassy in your home country. And the only constraint to that will just simply be the embassy in your home country's capacity to actually schedule visas. There's obviously going to be a very high demand, and the embassies are, often very overworked. And so they're just going to have to schedule them week by week and month by month. And frankly, if this bill passes, it doesn't matter if your visa appointment is scheduled in June or your visa appointment is scheduled in December of this year, or even into next year, conceivably. Your visa is, once this bill passes, your visa is protected and is retrogression free at any time that you go to your visa appointment. The expectation, of course, is that the vast majority of these nurses would come in this year in 2020. Not only that, but any nurse whose petition is filed up until a date that I'll explain in a minute, she would also get a retrogression-free visa. And by the way, anytime I'm talking about the nurse's visa, their family members, which are spouses and any children who are under 21 at the day of the visa appointment, will also get a visa. So again, any nurse who is filed anytime after this bill is passed will also get a retrogression-free visa. Again, even if that visa appointment isn't until later on this year or conceivably even into 2021. Again, our expectation is that the vast bulk of these nurses would be able to come in this year, in 2020. Now, we are only allowed to use 25,000 of these visas. We do not believe the retrogression has more than 10 or 15,000 current nurses in it, and that is inclusive of all Indians, Filipinos, and all other countries. There's been some talk on the internet. People are concerned that there maybe are 25,000 Indian nurses in the pipeline. There's no data to support that whatsoever. So you should, anyone who's writing that, if you read that, you should just mute them and no longer continue to follow them, because they are just, they're talking uneducated, and there's enough of that on the internet. You don't need to hear it. Now, the only thing is there's this 25,000 visa cap. The other cap is that this bill is also tied to something called an emergency declaration. President Trump put out an emergency declaration in March. That emergency declaration essentially says that the president believes that the U.S. is in a crisis situation because of COVID-19, and therefore he has declared an emergency, and that allows the president to do some things, to have some powers that he would not ordinarily be allowed to have. And in the U.S. system, and frankly a lot of systems around the world, presidents and leaders, prime ministers, et cetera, are allowed to issue these emergency declarations from time to time during times of crises, and it's very normal. And so the president issued that on March 15th or so, the week of March 15th. And so here we are at the end of May, and that remains in effect. At some point, the president will declare the emergency is over. He will say, okay, I believe that we are past the worst of this COVID-19 crisis. I don't know if he's going to say that next week, June 1st, or I don't know if he's going to say that 6 months from now. He may not even know. He's probably going to see how the COVID-19 situation evolves over the next few weeks and months. But whenever he says that, this bill falls away 90 days later. But I want to be clear. All that means is that new nursing petitions that are filed no longer get the advantage of a retrogression-free visa. Once this bill is signed into law, even if the president in June, so let's use this example. If on June 1st, the president declares the emergency declaration over, we count forward 90 days, that takes us to September 1st. That means that any I-140 that's filed between now and September 1st, or even earlier, gets a retrogression-free visa, even if their visa appointment is in October or November or December or even into January of next year. It doesn't really matter when the visa appointment happens. It only matters when your I-140 is filed. And so that's how the process works. We exempt the visas from the per country cap, which is the second bullet point. All that really means is that if by some chance we get close to that 25,000 quota that they are supposed to, the State Department is supposed to prioritize in the order of priority date without reference to what country you were born in. The third point is that it recaptures green card visas. That's a technical point that probably just isn't worth getting into, but that's where we are acquiring the pool of visas, and it importantly says that we are not changing the visa quotas. We are just doing this one-time allotment of visas. It does have some provisions to ask the Department of Homeland Security and the Department of State to fast-track these visas, and so that's important. So you can expect that if you're going to file your I-140, that your I-140 would move quickly, and you can expect that the NVC process and the embassy appointments, they should prioritize these above other occupational visas. And then this is important, and I know when we were putting this bill together, this was something that everybody, all the senators felt was very important. There is in this country, and probably a lot of other countries, maybe the country where you're viewing, there have been some furloughs of nurses in America over the course of April and May. And U.S. hospitals, as much as they value overseas nurses, the first people that they want to hire are local American nurses. And so this bill says that no one under this visa is allowed to work in a facility if that facility continues to have furloughs and layoffs of U.S. workers in nursing. So, if by some chance the hospital has furloughed someone in their IT department, that would not impact this. But if a hospital is currently furloughing or laying off a U.S. nurse, then they are not allowed to use this visa. They are not allowed to sponsor you for this visa. Frankly, it's our expectation that is, even though there have been some furloughs and layoffs in April and May, that is going to disappear, is our expectation here, into June and July as the U.S. healthcare system starts to take on more and more patients. In our country, and probably where you are, frankly, in April and May, U.S. hospitals were actually a little underutilized. There were actually fewer patients than anyone expected because a lot of the hospitals and facilities were waiting to see this bulk of American patients come in with COVID. And frankly, that didn't happen to the volume that everyone expected it to, which is good. I mean, it's probably good because it means that people are a little healthier than expected. I think the hospitals, under an abundance of caution, which was probably a very smart move, made sure that they had the capacity in case this COVID-19 bubbled up, but that didn't happen. And so now other types of elective surgeries, knee replacements, hip replacements, heart surgeries, et cetera, that had been postponed in April and May are now starting to happen in June and July. And so we do think that those furloughs of American nurses, that was a very short 1 or 2 month phenomenon, and we think that is. If by some chance it's not, then again, these hospitals are going to recruit the nurse in their neighborhood before they're going to recruit overseas. I think for the Filipino and other nurses who are listening to this, there are still going to be plenty of jobs here in the United States. And so it just will mean that you're not going to go to a hospital where there's been a furlough of American nurses. But again, I want to be clear, no one honestly believes that there's going to be any sort of even middle term, forget long-term layoff of American nurses or furlough of American nurses. That seems to be, by all accounts, a very localized and particular situation just in April and May. So those are the key points of the Act, then, Tanya.
Yeah, thank you so much for going through that, Chris, and giving all of that detail. I think the last point that you said is an important one from the American hospital and nursing home, the American facilities perspective, and that is that they want to make sure that they're not going to displace any American workers, especially nurses, of course. And I think that's really where this legislation is shown to be really sensible legislation and very positive legislation. We have a lot of questions about it, and we're kind of out of time, but I'm just going to show the next slide, which shows, as of Friday last week, the bipartisan support, which I think is really important, that bipartisan support, because it's not just slanted one way or the other from a political perspective, and hopefully that list will be growing soon. And the other area that I'm also...
Yeah, you can see on that list, Tanya, all the R's and D's. That means Republican or Democrat. If you just scan through the list, you'll see almost every time there's an R, there's immediately a D, and then there's an R and a D. And so that shows that it's bipartisan, both from President Trump's Republican Party and Obama's Democrat.
And the Democrats. Yeah. Thank you for pointing that out. And the last slide then is just to show that there are many organizations in the US that are supporting this, namely the American Hospital Association, the National Rural Health Association, Leading Age, which is really representing all of the nursing homes, long-term care, skilled nursing facilities. So there's a CGFNS, Alliance for Ethical Recruitment Practices. So there's a lot of support from within the US from many different organizations. We have gone over time. So I really wanted to thank Chris for sharing and illuminating us with such insightful information, really good advice. So I think that hopefully this will be very helpful for many people watching.